We are deeply concerned over the ongoing strike by doctors across the country. We are equally concerned over the hard-line position taken by the national and county governments towards the strike. What is worse, other interested parties are throwing their weight in support of the doctors, which compounds the matter further. The impasse between the health caregivers and the government has resulted in prolonged suffering for the sick and the vulnerable. The ongoing strike is making worse an already strained healthcare system, leaving thousands of patients without access to essential medical care. In many government hospitals, clinics are abandoned, ICUs are closed, and referral hospitals are even declining taking patients. This is dangerous, for many lose their lives. We call on the Ministry of Health and the county governments, health departments, to prioritize dialogue with the striking doctors to find a quick solution to the current crisis. The government should embrace dialogue and agree to listen to the grievances by the doctors. It has a responsibility to address the legitimate concerns raised by the doctors. Both parties need to set aside their differences and come to the table to find mutually beneficial solutions with the ultimate goal of reducing the suffering of the sick and vulnerable Kenyans who are in dire need of medical care. It is important that the doctors keep in mind that while it is essential for them to have their concerns addressed, it is equally important for the government to ensure the provision of healthcare services to its citizens, that it is not disrupted. The doctors should conduct themselves with civility during the strike and also consider going back to work for the sake of the sick in hospitals. It is crucial for all stakeholders to recognize the gravity of the situation and demonstrate a commitment to finding common ground. Both sides must demonstrate leadership and compassion and work together to ensure all Kenyans have access to the quality health care they deserve. And this concerns the many accidents that are taking place on our roads. And we realize that so many people are losing their lives on our roads because of accidents, many accidents that are taking place. Some of these accidents are taking place because some people drive while they are very tired, and especially those who are long-distance drivers, and they drive for long hours and they find themselves very tired and they are not able to change duty with others. But then also, even more seriously, those who are driving while they are drunk, either because of alcohol or because of other intoxicating drugs. I want to raise this because there are so many people who have lost their lives in the accidents that are taking place in our country, on the roads of our country. And to remind us all that when there is somebody who's maimed, his or her life, or even somebody who loses his life or her life, these people are coming from our families. We are finally the losers. We are finally those who suffer the consequences of these accidents. And I therefore ask that we all be careful, and especially at a time like this, when we have Easter holidays, that drivers may be extra careful in driving. I'm talking about this while in this church of Gaitega, where a few months ago, through a road accident, we lost 6 people, 6 CW women and the driver. We still lament that this happened, and we feel pained that we lost those 6 people of the same community. And it is for a matter like that I feel very concerned, and I ask that we all be careful when we go out driving on our roads. I wish you safe driving. The LGBTQ threat is real and is capable of breaking down the family unit and the entire social fabric. To address these threats to the family, I urge our legislators to come out to strongly challenge any laws passed in Parliament or elsewhere that are against the integrity of the family institution, and support any laws coming up in the Parliament that protect the family from emerging threats. I reiterate our position as the Kenya Conference of Catholic Bishops that marriage is desired by God, and as such, it is between a man and a woman. I urge parents to strive to be closer to their children so as to identify and address any negative influence on them before it is too late. I remind all parents that they have a responsibility to instill good morals in their children as their first teachers and role models, to dialogue with them and pray together as a family unit. The efforts that the Deputy President is making in the war against illicit alcohol and the drug and substance abuse is laudable and needs to be supported by all. The effects of illicit alcohol and drug abuse and substance abuse are too obvious, and they are dire. They range from wrecking the economies of the family to even death. I'm very much concerned about the deaths that happened in Kirinyaga, which would have been avoided had certain measures been taken by those concerned. There is need for the government to study the matter and identify the root cause of the alcohol problem in the country. Its production must be stopped by even controlling the sources of raw materials. Closing bars and other sale points and limiting the time that they operate are important steps in this endeavor. But it is also very important to address the supply side of the business. Suppliers must be identified and sanctioned, including closing down their businesses with immediate effect. The country cannot afford to lose any more lives to illicit alcohol. There is also need to come up with alternative livelihoods for those involved in selling illicit brews. But any list of solutions is not complete without including the psychosocial factors, alternative methods of spending free time that attract the victim away from the bars and such joints need to be proposed and, where possible, put in place. There are whole neighborhoods where primary and secondary schools are closing because of lack of young population, apparently resulting from alcohol and drug abuse. Such communities need to depart from the watch and see stance to one that is proactive, giving psychosocial support. In this too, the government support should be readily available, financially and needed logistics. Further, it should most importantly lay a foundation dealing with these challenges by enacting legislation that is unequivocal and easily enforceable.